Dr. Dave again at Kent Chiropractic and Acupuncture. Today we're going to be talking about neck and shoulder pain. That neck and shoulder pain typically starts right in between those two. We get those trigger points in our traps, like we see all so often in our office. We get neck pain radiating out of the neck, going down into the shoulder. So we're going to show you guys what a Softwave treatment looks like on your neck and shoulder today. So Matt, tell me a little bit about what you were experiencing and why you came into our office for this treatment.
So I had a lot of pinch nerves in my shoulder, sit at my desk all day with my mouse, to the point where my elbow wouldn't extend all the way to the tightness of my muscles. And the Softwave really helps me loosen up the inflammation. It gives me fuller range of motion. It's been a big change to my functional life.
Do you remember your very first Softwave treatment? What did you experience after your first Softwave treatment?
Quite a bit of pain relief afterwards. Fuller range of motion after the first treatment. It was very noticeable for me.
So before you started Softwave, when you very first came in, if you were to put a pain scale on it when it really bugs you at your worst, so 0's no pain, 10's the most pain you've ever had. When you're at work and this thing's just really bugging you, how high would that pain scale gotten?
8.5.
So an 8 pain scale out of 10. After your first Softwave treatment, what would you say it dropped down to?
Easily 4.
So cut it.
Pretty drastic after the first one, and then the consistent therapy's been even better.
Okay. And that's one thing we see a lot from patients, is especially people that are on computers, reached out with that mouse. That's where a lot of this comes from. And what we're doing, just to explain what we're doing here, is we are mapping the area of pain out. So mapping means we're searching for his problem areas. So Matt, let me know when we get to a spot where you're like, okay, I need it right there. Right there?
Yep.
Okay. So when you go across normal tissue, you're not really going to feel a whole lot. What you're going to feel is when we go across tissue that's damaged, that's when you're going to feel that discomfort come back, and that's what we want, because that means the treatment is going into the area that it needs to go in. The nice thing about the actual Softwave machine is it's an unfocused wave. So what it means is it's a very broad unfocused wave. So there's a big treatment area. A lot of the other imitation machines out there have a very focal, fine treatment area. So it doesn't do as good a job of treating, and it's harder to keep that area treated. So this machine's nice because it has that broad treatment area, and it also can penetrate up to 6 inches deep. So it definitely gets down deep into the tissues. So we worked the neck and trap a little bit. Now we're kind of moving down into the shoulder area. Let me know if we find some spots in here.
That's one right there.
Right there.
Yeah.
So we want you to kind of be experiencing about a 6 or a 7 on the pain scale. Would you say you're close to that?
Yeah, it's
okay.
When you get to the damaged tissue, it's very noticeable from the normal tissue. I describe it like when I'm trying to dig in to get some relief from my pain. This is what I'm looking for. It's a good pain.
What would you say to people that are watching this that may be considering Softwave? Do you think it's worth trying out?
I definitely think it's worth trying out. I've dealt with this shoulder pain for a long time, multiple years, and between the chiropractic treatment and the Softwave, it's been life-changing for me, truly.
Nice. Awesome.
Truly.
So that's an example of a Softwave treatment on your neck and shoulder. For more information, click the link below, and we look forward to seeing you in the office.